Good afternoon, and thank you for joining us for week 87 of the Flint Community Webinar on Coronavirus. This webinar is sponsored today by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. We're so excited that you've joined us today, and we're looking forward to an amazing webinar today. We have some great information for you. I'm excited to be your host today, Yvonne Lewis, one of the co-directors of the Healthy Flint Research Coordinating Center. We have been here for 87 weeks now with the goal of bringing to you, first of all, we were bringing to you information about a global pandemic. We hadn't heard about it before, and now we are 86 weeks in. We could not have done this, brought this credible information to you without the wonderful partners that have joined us on a weekly basis. For those of you that are joining us either by phone and you cannot see this wonderful banner, I just want to give you some highlights today. We do have the Genesee County Health Department with us. We have the Greater Flint Health Coalition. We have representatives from the University of Michigan Flint, University of Michigan Ann Arbor, Michigan State University. We also have representatives from the Genesee Health Plan, and more will be coming, so that if you have questions today, we're asking you, please put your questions into the Q&A so that we can answer them for you. We're, again, Genesee Health Systems is here with us today, along with the city of Flint. So we're looking forward to you putting your questions in. I want to also ask for those of you that are social workers and you're here today, please be reminded that we ask you to join the webinar at the beginning in order to get those credits. You must also complete the survey at the end. We will do a reminder at the end of the webinar today so that you will be sure to wait to get that information when the survey comes up. We also want to let you know today we're going to have some highlights from upcoming event that'll start next week, the HFRCC Symposium. We're going to talk to you today about some holiday preparations. And this is a question that's come up too, monoclonal antibodies. It was tough for me to get out. I had to get some education on how to say it correctly. We'll have a wonderful medical moment for you. We'll have updates from the Genesee County Health Department, the city of Flint, and we've got some very special partner highlights we want to share with you today. We want to get right into our session today with our roundtable. We're going to ask Dr. Reynolds, Dr. Wolford, and Kaylee from the health department to join us in the roundtable today. There have been many questions just this week alone, Dr. Reynolds, just this week alone, we've had questions about holiday preparations. We've had questions about the boosters and the vaccines, whether it's a full dose of a booster or is it a half dose? And we've just had questions about whether or not it's safe for pregnant women to take the vaccine and how will this affect their unborn child? Is breastfeeding make a difference? So we may not get into all of those in this roundtable, but we do want to start. Dr. Reynolds said, we do want to start. Dr. Reynolds, let's start with a little bit about the holiday preparations. We've talked about this before many times, because that was a question we were asked. How do we prepare for the holidays?
Well, I will repeat my colleague, Dr. Furholden's message. You must always have a plan. And the first plan is make sure the people you gather with are vaccinated if they're eligible. And limit the size of your crowds. And make sure the house is ventilated. Then when you serve food, it's not buffet where everybody dips into their own food. Have individual plates, and better yet, have your guests bring their food. And that's good since food costs so much these days, you know. The point of the gathering is so that you can socialize. You still have to maintain physical distance. I abandoned social distance, but physical distance is the point. And it's better to have different households sit at different tables, and don't have your house stuffy and overheated. But the point is, limit the number of people there, maintain physical distancing. If you don't know folks' status, or if you have folks who have a medical condition or immunocompromised, have them wear a mask. And those are the key things, but you must have a plan. Don't have your cousin Willie show up intoxicated and acting like a fool, and moving throughout the crowd and dipping into everybody's plate. I mean, these things happen. Am I being for real? So it may be the time to tell Willie, you weren't invited. We'll catch you after you get vaccinated and when you're sober.
So when let's talk about that. You say immunocompromised, and I always try to make sure we go back and clarify. Can you talk about immunocompromised? What does that mean?
Okay, you have a medical problem that reduces your ability to fight off infection. Either you can't produce antibodies or enough antibodies, or you don't have enough disease fighting cells. We call them lymphocytes because we may have some kids who are being homeschooled today, and I want to get them ready for medical school. So you may not have those lymphocytes. You may be getting cancer treatments. You may have just had a bone marrow transplant or an organ transplant. And so you're on medications to suppress your body's rejection of that transplant. So those are the folks who we really need to care for. And then people with chronic conditions, while they may not be in the classic definition of immunocompromised, because they have decreased natural function of their lungs or their heart or their kidneys, it would be prudent, it would be wise to protect them against exposure.
So these are precautions that we're asking people to consider getting ready for the holidays. Sometimes we don't think about these things. We just want to gather together as a family and have a good time, Doc.
Well, you know, so do I. But I've told you before, I've had to tell 2 adult children in my family, since you're not vaccinated, don't come home for Thanksgiving, don't come home for Christmas. And the window is closing if you change your mind and decide to get vaccinated. Because remember, it's 3 weeks after. If you got your Pfizer vaccine today, you get your second one in 3 weeks. And then you have to wait 2 more weeks in order for you to have adequate protection. If you have Moderna, if you get your Moderna, it's 4 weeks. And then you get your second shot, and you have 2 weeks before you have full protection. So uh, the window is closing rapidly, and I cannot risk the health of my household and my other family come because of their choices or lack of choice.
So this is one of the reasons why we're talking about it today, because we know what Thanksgiving is only 2 weeks away now, and then Christmas is coming. So people have an opportunity to think through these processes and make that plan for their families. A part of that plan is getting vaccinated. Now, I want to, Kaylee, just talk to you for a quick minute. And if either of you have comments on some of what Dr. Reynolds has said here, please do so. But with Kaylee, we talked a little bit about boosters and the third shot. So that's something else for us to consider. Can you give us some insights on, again, we've talked about this before, but we're still getting questions, boosters versus a third vaccine?
Yeah, absolutely. That's something we get questions about a lot too. The boosters and a third dose are 2 different things. So Dr. Reynolds spoke earlier about people who maybe had stem cell transplants, solid organ donation recipients. Those individuals would be considered immune compromised. So that third dose is not what we would call a bonus dose. That third dose is a recommended dose because those individuals are immune compromised, which means regardless of if you're getting Moderna or Pfizer, that's going to be that full dose. So it's the 0.5 mLs of Moderna and it's the 0.3 mLs of the Pfizer vaccine. Now for the booster doses, I myself, I don't mind disclosing I am not immune compromised. So I would be someone who got a booster dose. I got my first 2 doses. I was more than 6 months after that second dose. So I elected to get myself a booster dose. I got the Pfizer vaccine the first time. I also got the Pfizer vaccine this time around. The Pfizer vaccine does not change dosages for booster shots. So if you're getting a Pfizer vaccine, whether you're getting your first vaccine, your second, your third, or a booster, you're going to get that 0.3 ml vaccine. Moderna is a little bit different. If you're getting your first vaccine, your second vaccine, or a third vaccine, if you're immune compromised, you're going to get those 0.5 mLs. If you are getting a booster dose, so you're not immune compromised, you just want to boost that immune response, you're going to get half of that dose, so 0.25 mLs. So when you think about the milliliters that you get if you're getting a vaccine, 0.25 and 0.3 aren't that different, right? They're negligible when you're talking about that amount of volume. When you're talking about immune response, they've extensively looked at the dosages of these vaccines to make sure that they're giving appropriate doses. So that's why that Moderna booster is half of the volume, yet Pfizer has stayed at the same volume. And if you're immune compromised, you're also going to get the same volume of Moderna.
Thank you, Katie, for that. And now this kind of switches over here to you, Dr. Susan, because the question has come, what about pregnant women and the impact of their children, if they're breastfeeding, but on the impact of that unborn child?
So the recommendation currently is that there's no reason not to get vaccinated if you're pregnant. And in fact, if you're pregnant, it is recommended to get vaccinated against COVID. And there is the belief that that will, at some level, maybe even protect the child, because we know that immunity in the mom, the antibodies in the mom, for many things cross over into babies. And so for pregnant women, there is the recommendation, like the rest of us, that we should get vaccinated and protect ourselves and protect all those around us.
And Dr. Susan, I want to put a little plug in here because you're going to talk a little bit more about vaccines in children. So
Yes.
we talk about that right now, but stay tuned. You're going to hear some more about vaccines in children, because as Kaylee mentioned, and Kaylee, I do want to just have one more quick question for you. As Kaylee mentioned earlier, that this milliliter, it's the amount that we're getting in each dose. And so it's different. It's going to be different for children and it's different for adults. But here's another question that was raised this week that, and we know even though people get the vaccine and they're fully vaccinated, they still have the potential to get COVID, right? And we know right now our hospitals are really full and waiting in emergency rooms, there's long waits. And so one of the things that's come forward is this monoclonal antibodies. It took me like a whole 5 minute, longer lesson to get it right because I was saying it wrong. But monoclonal antibodies. Can you explain for us, Kaylee, a little bit about what a monoclonal antibody is? And just briefly, we are now having some opportunities for people to get the monoclonal antibodies.
Absolutely. So monoclonal antibodies right now are really the best, treatment response that we have to COVID-19. Monoclonal antibodies they're given via IV. So it's something that you need to definitely be provided either by EMS personnel, which we'll talk about a little bit later, or under the guidance of a physician or advanced practice nurse, etc. Monoclonal antibodies are great because what they are is they're essentially antibodies that your body would produce if you were going to fight off COVID-19 yourself. So for example, if you're a vaccinated individual, you get exposed to COVID-19, your body might be able to ramp up a response to keep you from being sick and to make it so that your viral load is not high enough that you can transmit. However, if you do get sick and you start to feel those symptoms of COVID-19 and you are going to have that higher viral load, you can receive monoclonal antibodies. And what those antibodies do is they react to the pathogen that's in your body, just like your immune system normally would. So these monoclonal antibodies are able to help you fight off the infection, decrease your viral load, and hopefully resolve your symptoms a little bit quicker by enhancing your body's natural immune response. And it looks like Dr. Reynolds would like to say something as well.
Come on, Doc.
Yes. Remember, this is not a substitute for all those other layers of protection. Vaccination, wearing a mask, physical distancing, washing your hands. And the other thing you have to remember is you must get treated with a monoclonal antibody in the early phases of your infection. So if you're full-blown symptomatic, short of breath, and not stable, you probably waited too long. So it's a good thing that it's available because it may keep you out of the hospital and may keep things from getting worse. But these things are not a substitute for getting vaccinated and using all those layers of protection that we always talk about.
Thank you. And I see you leaning in, Dr. Susan.
Oh, no, as usual, just agreeing with Dr. Reynolds. First 10 days, once you're hospitalized, you don't get the monoclonal antibodies then. That's not recommended for them. So you have to get it beforehand. And generally the recommendation is within the first 10 days. So don't wait.
And this is something that everybody should, if they're in this space, they need to be talking to a primary care physician. Is that correct? I mean, they need to get some medical advice, not just raise your hands and jump in.
That's right.
Okay, so it's really important. We're going to talk about this some more. This is not the end. We just wanted to raise this because I know community members have been asking. And when we hear that there is a EMS provider that may be offering this, people want to know. So we're just trying to give that insight. Dr. Reynolds, I see you, and I'll come back to you, Kaylee.
Yes, and I repeat myself, nothing is a substitute for vaccination. And the other thing we need to emphasize over the holiday season is testing. If you're going to see an immunocompromised relative, if you're going to see a 93-year-old mother like I do, and you left a crowded situation or you just got back from traveling by jet, wait about 3 or 4 days and go get tested before you go see that person. And if you're in a situation during the holidays where folks just got out of control and you were concerned about your status, you should be, go get tested. You know, wait a couple of days, 1 or 2 days, go get tested before you start mixing with your other loved ones who may have specific medical warnings, you know, so please think before you act.
Thank you. And Kaylee?
Yeah, so Dr. Reynolds makes a really great point about testing, and that is another tool that we have at our disposal. I do want to put in a plug for the 3 specific testing sites in Flint. I've been tested there myself, and they're very well run. They're very quick. You can go without an appointment. You can make an appointment if you would like to. They do the antigen testing. They do PCR testing if you request it while you're there. So those are great options. They're completely free. They do not require health insurance. They don't ask for your health insurance. Those are completely free sites. So those are good resources that people can use to add that extra layer of protection before they gather for holidays. And again, they're drive-through. They're super easy. You can either make an appointment and you go right through, or even when you drive up, my experience has been, I don't think I was there for more than 10 minutes. So those sites are really great. They're very easy to use. The staff is very friendly. So I would highly recommend those. And then speaking to your point about monoclonal antibodies, MedStar Ambulance Service is offering that treatment in home. They're really trying to try and keep people out of hospitals. And we know that monoclonal antibodies can potentially help with that. So if that's something that, you become positive for COVID, you have symptoms, something to talk to your primary care physician about to see if that treatment option is right for you. And that is a potential possibility that it could be done in home through MedStar.
Thank you so much, Kaylee. And I want to appreciate you, Dr. Reynolds, Dr. Wolford, and Kaylee. And the one important thing you said is to see if it's right for you. Make sure you get those questions answered so you can make sure it's right for you. And you gave us a great segue to our next presenter, and that is Sherelle from the Genesee County Health Department, who is going to give us some insights on where we are, as well as telling us about those sites that we can go get tested and vaccinated. Good afternoon, Sherelle.
Good afternoon. How are you?
Great.
Good. Thank you for having me today. So I wanted to update you all with information about where we are with our vaccination rates in Genesee County. We've almost vaccinated about 365,000. We increase our efforts every day. We have maximized our clinic settings. So we have multiple clinics during the day throughout the week so that we can get our children who are now eligible for a vaccine. Next slide. Yes, so as I was saying, children are now eligible ages 5 through 11 for the Pfizer vaccine, which is a third of the dose of Pfizer vaccine for our adults and teenagers. So adults receive 0.3 mLs, children receive 0.1. And Kaylee already went over the difference between a booster shot and a third dose for immune compromise. So I think we're all up to date on that. I do want to stress that the holidays are coming up soon, and we especially need families to take precaution during these holidays and get your vaccine if you have not gotten it. And limit your guests at the gatherings. So in order to get your vaccines in the community, Genesee County Health Department has implemented a few upcoming clinics. On the screen, you can see that we'll be at EAJ High School on today from 3:30 to 7 p.m. So when the kids get out of school, come up to Mount Morris High School, we have vaccines for them. And Sunday, we'll be holding a special clinic because we know that people work throughout the week and it's hard to make it to the clinic. So Sunday will be at Central Church of the Nazarene, where we also hold a steady clinic there every Wednesday. I don't think my time is correct on those slides. I think that is from 3 to 5 on Sunday. Hopefully Kaylee can correct me if I'm wrong. And then Tuesday will be at Our Lady of Guadalupe, which is a standing clinic in the community, as well as Gates Elementary School. And that one will be from 4 to 7 p.m. And next Wednesday will be at Central Church of the Nazarene, as well as Southwestern Academy. Central Church of the Nazarene, we're always there Wednesdays from 10 a.m. to 12 p.m. And at Southwestern, we'll be there from 3 to 6 so that we can get the children in after school. And Thursday at Shiloh Missionary Baptist Church from 3 to 6 p.m. All are welcome. Lake Fenton at the Lake Fenton High School next Friday, and that is taking place between 11:30 and 5 p.m. I'm sorry. Yeah, that's right. 11:30 and 5 p.m. And so this brings us to our point of where you can get your COVID-19 test. On the screen, I have listed multiple testing sites. I do want to make the community aware that our positivity rate of COVID cases is steadily increasing. In a matter of days, we went from 17.4% to 19.1%. So I strongly urge that you get reoccurring testing just to make sure that you are not COVID positive or spreading it unknowingly. And you can do that by visiting Word of Life Church, Bethel United Methodist Church, as well as Macedonia Baptist Church. These three churches also provide the Pfizer vaccine as well. And you can visit one of your local Rite Aids or Walgreens or our Hamilton Community Health Network. Now, if you visit our website, gchd.us, there is a listing of specific Walgreens and Rite Aids within the community that you can go to for your testing. And next slide, please. As always, our homebound citizens matter too. So we are available to you too. And if you need a vaccine and have not received one, give us a call at the health department at 810-344-4800 so that we can get you scheduled. Or you can visit www.gchd.us/vaccine scheduler/ and I just want to say, stay protected. The holidays are coming up and be safe.
before you leave us, Sherelle, I want to thank you so much for that update and the work that the health department is doing. We heard some wonderful reports about the community events that are happening at the schools. No, unfortunately, more and more of our children are testing positive. There was kind of a myth early on saying that children would not get COVID. But what we're seeing now, even in the hospitals, that children under the age of 17 are being diagnosed with COVID. So this is a really important thing. I had a parent ask, and I think Dr. Susan is going to talk about this, so she's up next, that they're wondering where they can go and get tested. They're wondering where they can go and get the vaccine. So we appreciate you sharing this information, and we encourage those of you that are listening, please help us share this information so families can make the best decision for themselves. Yes, Sherelle.
Yes, because we are seeing outbreaks in our schools. So, and that's mainly within our students who are children, adolescents. So the vaccine is important for our children. That's all I wanted to say.
Thank you so much, Sherelle. So we're going to hear now from Dr. Wolford, and she's going to give us some really important updates as it relates to vaccines in children. Dr. Wolford.
Thank you so much, Siobhan. So I would like to start off by talking a little bit, as you just did, about why we want to even consider doing vaccines in children, right? Because as you say, from the beginning, we had this idea that kids actually don't seem to have too many problems. So why vaccinate? Well, because we know that kids actually do have a lot of problems. We know that 1.9 million have been infected in the US, that over 8,000 have been hospitalized, including those who've had that MIS-C, the very severe complication that comes a few weeks after COVID. Even for kids who don't have symptoms, they can still get that. And we have over 2,000 who've had that problem. And then we have 94 that have actually died. And you say to yourself, was 94 a lot? Well, it's about just less than 2% of all the kids who died in this age group over the last year, and makes it the 8th cause of death for kids in this age over the last year. So something that's pretty serious. So as a result, Pfizer went ahead and did studies to see if we could protect these kids with a safe dose of the vaccine. And they found that they started off their phase 1 study, the study with just a small number of people. They had 48 children, and they looked to see which dose works best. And so they looked at decreasing that dose, and they realized that at a third of the dose, we could get the good effect and 90% efficacy and above without severe side effects. And so now that once they knew the dose, they then went ahead to their phase 2 and 3 studies, which, as you know, is where they get more people involved. So they started with about 2,268 children, and about 1,500 got the vaccine, and then 750 of them got the placebo. And they compared those children over time, looking at them. By the time they went to the FDA, they had just over 2 months of data, but every month that goes by, they have more data. And in fact, since studying these initial 2,268 children, which the data comes from that I'm going to share, they also did another 2,300 children, and are finding very much the same results. So they compared these children to those who were people who are 16 to 25 years of age, as far as side effects were concerned. And they found that the kids did better in pretty much everything: headaches, fatigue, all of those sorts of things. The only areas where they were a little bit more, they saw a few more symptoms, was that these children had more redness at the site of the infection. They had more swelling at the site of the infection. But interestingly enough, they didn't have more pain. And so we don't have to worry about that. And in fact, they don't recommend giving Tylenol or Motrin beforehand. Wait till they get the shot, and afterwards, if they have symptoms that require it, then you can go ahead and give that. So when the experts looked at this and decided, is it good to give this? What evidence? How strong is this evidence to be able to give the vaccine to these 5 to 11-year-olds? And they looked at the benefits of the vaccine for this age group in preventing the symptoms. they said we are level 1, high certainty. That's the highest level of certainty you can have on this 4-point scale. We are very certain that it is beneficial for children. But then when they looked at the harm, and this is why people might have questions about kids getting the vaccine, because they may have heard that when they looked at the harm in it, while they think that it protects us again or protects children and does not cause any harm, their certainty was a little bit lower only because of the smaller number of people who've had the vaccine so far in this age group. But all the experts, they overwhelmingly agreed that this is very safe and likely to cause no harm, because the harm that everybody is concerned about, most people are concerned about, is this myocarditis, which we know occurs more in older children and doesn't occur much in younger children. And so when they looked at all the possibilities, the risk of getting myocarditis in this group compared to getting it, if you get in this group, if you get COVID, they're much more at risk for getting it from COVID than they are for getting it from the vaccine. And so I just wanted to emphasize a little bit about this issue of the myocarditis and why it is so hard to give a definitive answer right now. And it's because we so rarely see it. So if we think about, can you see my lentils here? This brown lentil here is a person who got the vaccine and did very well. This red lentil here is the person who got the vaccine and got very sick, like with myocarditis. Now, if we consider this cup as every kid in the US who could possibly get the vaccine, right? But we can't test every kid in the US. We have to take a sample of those kids in the US. And we could take a small sample, like with my teaspoon, or we could take a larger sample, like with my medicine cup. Well, if something happens very commonly, see how many red lentils are in there? If something happens very commonly in a population, then you can take a small sample and you will get red lentils in there, right? Because even in a small sample, you will be able to find it. So if something bad were happening commonly, those Pfizer tests would have shown it. But it's more like this. Those negative problems happen so rarely that you would have to take a huge sample, many of them, to try and get one that has a red lentil. And that's why we have in their studies, in the size samples they have, they found no problems at all. And they're just saying, we'll just need bigger and bigger studies because this thing is so rare, we just don't think we can find it unless they're very big studies. So hopefully that answers some questions about the vaccines in children.
Thank you, Dr. Wolford, because some of the parents were asking, what is the research saying? Because it feels like, for even the adult vaccine, this all happens so quickly in this rush to get these vaccines out. And so you're saying that there were small studies, but they're continuing to study?
That's right. They were smaller studies but it's still several thousand children. They were, so far now we have over 4,000, right? They started out with 2,260 something, and then they added another 2,300, and they're following all those children. So they're thousands of children. But they're following them, and they're going to keep following them, and we're going to get more and more data. As we always say with COVID, we're learning more and more all the time. But I want to be clear that even with these studies that had smaller numbers than we may need to be able to find these rare problems, the experts overwhelmingly thought this is definitely going to be beneficial to these children, and we believe it is unlikely to cause any harm.
So Dr. Susan, even though our children right now, and many of us are not in a formal research project where we're being formally studied, we do have the opportunity to have some input. So if there is an adverse reaction or if we feel something, we should report it.
Absolutely. So we should report if we have anything that we think is unusual. Of course, there's going to be redness. Of course, there's going to be some swelling. You may have a little fever, a little bit of fatigue. Those things you will see. But if something else were to happen that you find concerning, you should report it. And then you can report anything. And then the investigations occur to find out, are these things related to the vaccine? Because it's important to note that even with myocarditis, for example, there's a baseline number of cases that happen anyway outside of the vaccine at all, because other viral illnesses cause it, other things cause it. So there's that baseline. So maybe you had it just because you were about to have it, or is the symptom you're having because of the vaccine? And by reporting it, the scientists are able to try to work out the answer to that. But really, all of the studies that have been done so far, all of the evidence from people reporting things show that the risk of illness with these vaccines is very low.
Thank you, Dr. Wolford. And we're going to try to make sure we put that website in there. They could go to the CDC website for adverse events or effects to the, but I want to just capture one more thing that you talked about, and you said investigation. And so we want our participants to understand that if they report something, it is taken very seriously. And that's how with the myocarditis, it was really sought out because somebody said, this is something happening, and they began to look into it. So can just give us a little snippet of what that process looks like.
So yes, so they look to see, are we seeing a larger report of these, whatever the occurrence is? Are we seeing more of these red lentils than we should have seen otherwise? And then are we seeing it close to when the vaccine was given? What is the timing? So, and where are we seeing it? So they do a thorough investigation, because nobody wants there to be problems caused by a medication or a vaccine, particularly a vaccine. And so there is a lot of investigation that's done. And as you say, that is why we're able to identify when a problem is associated with a vaccine, and we can then say, oh, is it this age group or is it not? And so that's what happens with these investigations.
Thank you so much, Dr. Wolford. And you're going to come back in a couple of weeks with another really important medical moment for us. But we thank you for what you shared today. And hopefully some of this information will help address some of the questions that parents have. But I do want to say, if you have questions, please put them in the Q&A, and we'll continue to bring this information forward and answer them for you. The other thing that you made clear to us is when these things happen, sometimes it drives policy. It drives decisions that are made by our elected officials, CDC, the World Health Organization, or even our local policymakers. And so one of the reasons that's important is because the Flint Center for Health Equity Solutions is now providing us this policy brief. And so Mary Catherine Crawford, who is a public health practitioner, is going to give us the updates from the Health Equity Solutions Project. Mary Catherine.
Yeah, thanks, Yvonne. So I'll kick right off into the trends, starting with our cases by race. So this week we saw confirmed cases increase in both Genesee County and in the city of Flint. So I just want everyone to remember, these are going to be all the cases shown up to that red line where we have our unknown cases by race. So in Genesee County, we increased over the preceding week by about 100, whereas in Flint, we saw cases go up like an additional 37 cases over the prior week. We are still seeing more cases where race is unknown than where race is identified. So while we of course still want to encourage and hope that labs follow the law and report demographic data back to the health department, I think it's really important that while we're on this community platform for people to know and spread the word, that they need to, one of the best things they can do for the community and for contact tracing is to answer those calls from case investigators from Genesee County Health Department. This is going to be really the only way we're going to reduce these red boxes at this time and get race and ethnicity data identified. So please, if you've been tested for COVID, if the health department is calling, if they're leaving you messages, one of the best things you can do for yourself, for your neighbors, for our colleagues at the health department is to give them a call back so we can get that information filled in. I do want to point out that the positivity rate does continue to climb, which is indicating not enough people are getting tested, or those who are ill may only just be getting tested because of symptoms. This is certainly not what we want to see as we're heading into, the holiday season, or a time where we know people are going to be gathering with those outside of their homes in social pods. So I just want to point that out and give everyone that reminder to get tested. And then another trend that we're seeing that we've touched on today is this increases in cases amongst school-aged youth. So I wanted people to be able to see what that looks like going back about 10 weeks or so. So I'm not sure if it was said, but this group is making up about 20 to 25% of cases now in Genesee County. And the number of cases in this group continues to increase. So I not only wanted to show you this, but also point out a really important difference between school outbreaks and school clusters, because I have seen some reports where the two are used repeatedly. And that's also something I'm more than happy to invite Kaylee and Sherelle on if they have anything, any added context that they want to give to the difference between clusters and outbreaks. But really, the cluster is when the health department finds that there's multiple COVID cases within a school setting, but they are not all tied to one source or link or in school transmission. Whereas the school associated outbreak is where you have multiple cases where we can actually tie that back to a known epidemiological link into a school setting or by a school associated event or extracurricular activity. And I just the reason why I point this out is because, again, I did see those terms used interchangeably quite a bit. And I, including an article that had cited that Flint had one of the largest outbreaks in the state, when in fact it was really a cluster. So that's not to say schools don't need to stay the course with preventative measures. Of course, that's really important. But when it comes to identifying sources of exposure and transmission, it's really important to have some clarity on these terms. And then I do just want to invite if Kaylee or Sherelle has anything to add or more clarification, please feel free.
No, that was a great explanation, Mary Catherine. Thank you for that. And I do think it's important, especially when we're looking at the cases that schools are reporting. Just because a school is reporting a case on their dashboard does not mean that that case was necessarily associated with in-school transmission. We know that there is a lot of county transmission just in general outside of school. We are monitoring for situations where there might be in-school transmission, and at that point we work with the principals and the superintendent to determine appropriate actions. But just because the school puts a case on their dashboard does not mean that that was a case of in-school transmission.
Yeah, thank you so much. And that's just why I really wanted to kind of hit that home, because it's so easy to see reports and kind of and not use, right, especially if you don't have the training, use that public health eye to really identify what that means or ask the right questions. So thank you. And so next, I just kind of want to drive home these 4 Ps that Dr. Reynolds started in the roundtable. So prepare your guests. And I'm actually surprised I didn't hear him say it today, but I have to repeat one of my favorite lines from Dr. Reynolds, which is, no need to bring, don't bring lottie zoddy and everybody. No randos or last minute plus ones. That's going to help keep the rest of your guests safe. Prepare your space with a sanitizing station at the door, clean your home in advance, and leave cleansing wipes like in bathrooms or frequently touched surfaces so guests can help clean up after themselves and wiping surface down. Another really important thing is practicing prevention at the gathering, keeping your home ventilated, opening some windows, don't let it get too hot and stuffy. Dr. Reynolds had already suggested, sitting, separating tables and having one person, delegate, give them the job of serving the food rather than doing a buffet style. So you don't have people talking over food and leading to potential spread of any infection. And the last P is definitely proactive follow-up. Clean up properly when guests leave, get tested, ask your guests to report symptoms or any positive COVID tests back to the host so that they can then contact others that they've had over. So I hope everyone keeps this in mind, and you can find this graphic in the brief. So make sure, of course, that you're signed up, and I will go ahead and close out with some policy updates. So a few weeks ago, we talked about this really important bipartisan pair of bills to end sales tax on certain hygiene products. So I'm really excited to share with you all that this is now the law. Governor Whitmer signed what is known as frequently or more commonly known as the tampon tax bills, which took effect immediately as soon as she signed those bills into law last week. And this is actually going to reduce the cost of basic health products that make them more accessible to all individuals who may need them. And I also want to share that the package of House and Senate bills we discussed a couple weeks ago to create a school voucher program, which would ultimately divert funding from public schools to private and religious institutions, that package of bills has actually been vetoed by Governor Whitmer. And the reason why this is important is because that action actually prevents further inequities in public education funding. And this has been, more important than ever during a pandemic that has, really impeded students' education in the state and has really worsened racial and economic disparities as we know it. So this is going to prevent in the first year itself at least $500 million from leaving the school budget for public schools. So I always promise to keep you guys updated on policy, and we've had movement on quite a few bills this week.
Thank you so much, Mary Catherine, for those updates. And remember that what we say, our voices do count, even though it doesn't seem so, but our voices do count. So continue to share with others so that when these opportunities come up for us to share our voice, we are able to do that. Thank you so much, Mary Catherine. So now we want to hear from the city of Flint. City of Flint, Lottie Ferguson is here with us today. So Lottie.
Good afternoon. My apologies. Can't figure out what's going on with my camera. I'm going to have to talk someone into buying me a new computer, I suppose. Just a couple quick updates from the city. There are a lot of problems with speeding through residential streets and main streets. And so we're happy to announce that the Flint Police Department received some speed humps, and those will be installed soon to hopefully help slow some of the speeding that's been going on in and around the city. City of Flint is hiring. There are several really cool jobs posted on the City of Flint's website. Visit cityofflint.com/jobs if you know someone looking for work. We are hopeful that we get some folks who really have a heart for the city and really want to take on some of the cool things that we've got going on. Chief Green is out in the community. He's got coffee and donuts with the chief. His second week will be at the North End Precinct Mini Station. There's more information regarding that on our website. And also bag it. Make sure that you are bagging your yard waste and not sweeping it to the curbs. Waste pickup program has a limited number of yard bags. They're available at the desk in the lobby of City Hall. Bagging ends on November 30th, so be sure that you get your yard waste, your compost taken care of by then. And lastly, the Water System Advisory Council meets on Tuesday, November 16th at 5:30 p.m. We are expected to have that broadcast over YouTube. So if you've not been able to join, you can see it on YouTube beginning next week. More information is on the public notices pages of the City of Flint. Again, that's Tuesday, November 16th at 5:30 if you've got questions about what's going on with the water system.
Thank you so much, Lottie. Appreciate you giving us that update from the City of Flint. Always good to hear that things are moving forward for our community. Next, we're going to share with you an exciting event that's coming up next Friday. It'll be during our time. So we want to invite you to be a part of the Healthy Flint Research Coordinating Center's 2021 Research Symposium. So I'm going to ask Dr. Susan Wilford and Tricia Pachowski to come on and help me share this information with you today. We're looking forward to being able to share how we have partnered together to build capacity, build partnerships, and advance health equity. So Dr. Wilford, we've got some exciting things happening next week, starting at 9 a.m.
9 a.m. It is going to be so exciting. We have a greetings. We'll be being brought welcome from the mayor. We'll have comments from the chancellor from U of M Flint, Dr. Dutta. We have a keynote speaker by the president of Mott Community College, Dr. Walker Graffia. So we are so excited about that. And then following that, even if one can be more excited, we have a panel with projects from many familiar faces, right? So Dr. Deborah, along with Isaiah and Moses, will be presenting. We have Rick, Dr. Sadler is going to be presenting with his team, and Lisa will be presenting from U of M Flint. So we have a phenomenal panel. And as you know, that the most wonderful moderator that I know is Ms. Yvonne Lewis, and she will be moderating that panel. So you know it will be fabulous. We'll be giving out awards, and following that, we'll have closing remarks for the morning by the provost, Dr. Collins from U of M Ann Arbor. And I am going to let Tricia speak about the awards because we got switched to that slide.
No, thank you, Susan. Really quick, just to let people know, we're still taking award nominations till the end of business today. So if you have an academic or community partner, both an early career or a champion, you can go to our website and submit your nominations. We're also looking for a community academic partnership that you want to nominate. So those are due today. We extended the deadline to get more of the community to submit.
And so Tricia, if they go on the HFRCC website, they can see all the information right there on the website?
Yeah, they're going to click on the seminar link and it'll have like the information for to register. And then we also have the nomination categories. Early next week, we will be putting the agenda on there as well.
Give us a couple of quick highlights. You said the nominations, but can you tell us a little bit about the nomination process? So it's a
Qualtrics form. It's a survey form. You don't have to nominate for each category. You're going to pick the category of who you want to nominate for. So early career, someone who's been doing this work for less than 10 years, either community or academic, and then a champion who's been doing the work a long time. So you need to know their name and you need to give us a blurb about why, so that if they win next Friday, we can announce it. And we can also let you and them know that they're going to be a winner.
So Dr. Wilford, I just want to take a step back and talk about how important this keynote is. There's a very significant gentleman from that historically worked at the University of Michigan in Ann Arbor that the keynote is named after. So if we could just kind of flip back a slide and talk about that particular keynote that Dr. Graffia is going to give. And I think it's significant as a president of Mott Community College, she is giving this keynote this year.
Absolutely. So the keynote is named after Dr. James Jackson. And so we've named it the James Jackson Memorial Keynote presentation. And Dr. James Jackson was one of the foremost researchers looking at the impact of racism and disparities on minorities, particularly African Americans, in the US. And his work was just landmark work in this area and recognized across the country and internationally. And then last year he passed away. And so in honor of his work and his life and his legacy, we named this keynote after him. So the James Jackson Memorial Keynote presentation.
And Dr. Griffith has just this powerful vision and understanding about how the community college can be a segue to helping our young people and those who may be non-traditional older students move into this research world and be prepared for the four-year institutions. So she's going to make that link for us on Friday.
Absolutely, because we really believe that for research to have the greatest impact, to be able to make a difference in the lives of people, it needs input from various sectors. It needs input not just from those in academic institutions or four-year academic institutions, but from community colleges, from children, from parents, from organizations, from churches. We need all of that input, all of that collaboration to be able to do work that actually makes a difference and improves health for all.
And then when we get to the panel, and we don't want to give too much away because you need to come to the symposium next week, but when we get to the panel, you'll really see the community academic partnerships at work, where Dr. Deborah Verholden has worked with our community foundation to put out those rapid relief dollars from our community. You'll see where Dr. Rick Sattler has worked with our community, Genesee County Health Department in partnership to put out some of this rich data that we're now able to see. And of course, then we're going to hear about another project that's an educational piece with Dr. Lisa Laparouse. So please join us because it's going to be a great, great session all day. And then, as you said, we'll be giving these awards. We're going to hear expressions from the key people at the universities as supporting the partnership. And then following the symposium, we're going to have another webinar. So you don't want to mix next week because we're going to have a webinar at noon with some good information from our partners. And then we're going to have what we call the research seminar. I just want to take a couple minutes to talk about the research seminar because it is something that happens every other month. So Dr. Wolford, can you just expound upon the research seminar that will happen at 1 o'clock next week?
Absolutely. So we've been doing the webinar for a number of months now, 87 weeks. And we like to give information about the science and about the research that's ongoing, but it's hard to cram it all into a webinar. So this is why we have the seminar every other month where we can discuss the ongoing research in more detail. And this research is relevant to partnerships. It's research that incorporates partnerships, and it's relevant to COVID. So if you'd like to learn more about just hot off the press research that's going on about COVID and related to Flint, then you don't want to miss the seminar. Now, you don't have to register for the seminar. You can just come on to the seminar, but you do need to register for the symposium in the morning, and we'll give you the instructions, all the links to be able to get on, and you will not be disappointed. This information is important. And there also, along with the keynote presentation, there is a roundtable discussion and your questions can be answered, and a spotlight that highlights some emerging research and often opportunities to get involved and engaged yourself. So please don't miss it. Come out and join us. Well, stay home and join us.
Thank you, Dr. Wolford. Now, we're not going to tell you anything else. We want you to go on the HFRCC website, info@hfrcc.org, and get more information. I want to take a couple of minutes and especially appreciate every week now until week 100, we're going to be giving some highlights to some of our partners. Today, we want to thank the City of Flint, who has been a partner from the very beginning, Genesee County Health Department, and the Genesee Health Plan. Every week, someone from these organizations have been on to help provide information for you that will hopefully and has hopefully helped you make some good decisions for yourself, but also share with other community members. Dr. Reynolds has been key in this, along with Kiana Towns and Lottie Ferguson, as you've heard from earlier. The Genesee County Health Department has had a number of representatives, and we appreciate our new health director who has made sure that they're here and represented. And Jim Melanowski from the health plan, he's going to join us next week to give us more detail. Now I've got 1 minute to say to you, to the social workers, please, and community health workers, be sure that you sign in and be sure that you complete the survey immediately following the webinar today. You must be on the whole webinar to get credit, but please be sure you fill out that survey so that can link to you and you can get those social work credits. We want to invite you to join us again next week. Be here, like us on Facebook, subscribe to the YouTube channel. Ask any questions that you might have at info@hfrcc.org. And we want to be sure that you call us if you have questions, because those other venues don't work or your questions are such you want to make sure we get it. Call us at 810-835-2130. And we say every week, thank you for joining us. We look forward to you joining us again next week on November 19th for the Research Symposium, the Healthy Flint Research Coordinating Center's 58th webinar and the Research Symposium. We appreciate you and look forward to seeing you again next week.